Republican Senator Kay Bailey Hutchison of Texas. Thank you very much, Senator, for talking to us. All right, so the House has spoken, and now it is up to you in the Senate. So how far is the Senate from passing a bill, or will Republicans just try to filibuster this legislation altogether?
Oh, Julia, we will do everything to try to slow this bill down so that the American people can see what's really in it. The tax increases, the mandates, the taking away the choice that people have. Once we have that single-payer system, it's going to take over the private insurance, and people are not going to have the choices that they have today. It's a terrible bill, and we will do everything we can to stop it.
Democrats are still trying to iron out whether the public option should include an opt-out clause for states. In other words, should employers be required to provide coverage to their workers? How will Republicans in the Senate receive that?
Well, what's not clear is if you have a state opt-out, do the people still have the cuts to Medicare that are in this bill? $400 billion in cuts to Medicare. So if the Texas opts out, are we still going to have the cuts to Medicare Advantage that 400,000 Texans enjoy right now? That's not clear at all. And even if it were clear, you could opt out and you wouldn't have these cuts. Eventually, this single-payer system is going to envelop everything. That's what happened in Great Britain, it's what happened in Canada, and it will happen here as well. We've got to stop the single-payer system. We've got to address health care reform, which we all agree we need,
right, with
lower costs, more options for people to have affordable coverage. That's what we need.
One argument you also make is that even if a state opts out of the government health care plan, that state will still face higher premiums or tax increases. The Democrats insist that's not true.
Well, of course they will, because if you're taxing the insurance companies, which both the House and Senate bill do, it's going to raise premiums for everyone who buys insurance from that company. It's a no-brainer. Of course there will be higher costs for everyone who have health insurance now. And then, of course, it's going to be more and more expensive to have the private insurance that you choose.
Right.
So you're going to go to that government option that will clearly be less expensive and subsidized.
All right.
It's not going to work, and we're going to try to stop it.
Another tough issue, the decision of whether or not to tax the rich or tax high-cost health care policies.
Well, the House bill, of course, taxes the rich, and I think the real issue here is the tax on every individual. Every individual will have to pay a tax if they don't have health care coverage. Every small business will be fined if they don't have health care coverage for their employees, and at certain percentages, 65 and 72%. That means every cost is going up. Every premium is going to go up for people who are insured, and people who don't have health care coverage are going to pay a fine anyway. And it's not the rich, it's everyone. So it's taxes, it's mandates, it's cuts in Medicare, and it's going to eventually erode our system of health care today and put it into a big government-run plan.
Julie Kurtz was just reporting about Majority Leader Harry Reid and him asking how much this bill will cost. He has yet to get a bill together that he can take to the floor. Now he's asking how much is it going to cost. In fact, he's waiting for the Congressional Budget Office to score various proposals he has sent over. This is going to take time. I mean, are we looking at a vote anytime in the near future?
Well, the Majority Leader Reid has said that we're going to start voting. First he said right after Thanksgiving, and then he said as soon as possible. They are trying to get the score, but we know it's in the $1 trillion range. We know that. That's what the House bill is, and it's what the Senate bill will end up being. $1 trillion is what it's going to cost. So you're going to have taxes and mandates, government subsidies, more government growth. This is going to add to our debt eventually, while it is also tearing down our health insurance coverage.
All right, Republican Senator Kay Bailey Hutchison of Texas, thank you very much for talking to us.